Hello everyone, I'm Uwa. I'm about to go into my second year studying medicine at the University of Nottingham. Actually no, by the time the video is out, I will be my second year studying medicine. If you're new here, it'd be great for you to stick around and join the gang. So if you enjoyed this video, please leave it a like and hit that subscribe button. Also, turn on post notifications so that you never miss one of my uploads. In this video, I'm going to be telling you the best resources that you could find out there as a preclinical med student. Well, these are the best resources in my opinion, and also I think, let me check.
A few moments later.
The majority of these resources are free, which is absolutely great. This video is brought to you in collaboration with 360 Medics. 360 Medics brings you all the medical resources that you will ever need into a single app. I'll give you so much more information about 360 Medics as we get on with the video. Let's get into it and let me tell you the best resources that you can find as a preclinical med student. So this first resource is something that you've all heard about, or there's two things really, but it's two things you've all heard about, and it's really going to strengthen your revision, your understanding of the content and your knowledge, and that is Quizlet and Anki. So these are two softwares which help you practice active recall and spaced repetition, which anyone knows is the best way to strengthen your memory. The more content you've got in your head, the more you remember, the better you're going to do in your exams. You would have heard a lot of people say that at med school they don't make notes, and it's true, they don't. They cut out the middleman and they go straight to the flashcard. You'll find in med school you're given a lot of content, but there's only a certain amount that's actually important and you actually need to know. So by making these flashcards and by doing active recall, spatial repetition, you're able to learn content in a faster, quicker and more effective way. I've said Quizlet and Anki, but really I only use Quizlet. I have got Anki, but it's got a very unfriendly user interface. Quizlet is just so much easier to use. The next resource, again, is two resources, but they come under one umbrella. So they're part of the Teach Me series. You've got Teach Me Surgery, and the two that I'm going to talk to you more detail about are Teach Me Anatomy and Teach Me Physiology. I wish that I found Teach Me Physiology earlier on in the year, because when we're doing a lot of biochem at the beginning of the year at Nottingham, it can seem very confusing, very overwhelming, and like you just don't really know what to focus on and what the key important parts are. I don't think Teach Me Physiology is specifically aimed at medical students, but it does have a lot of the key information, and it does focus a lot on that key information you do need to know. There are some extra bits, but from your own course you'll know what you actually do need to know, what you don't need to know. But Teach Me Physiology just summarizes all the confusing biochem really eloquently, and it just makes learning it so much easier. So as with Teach Me Anatomy, they summarize all the key things that you need to know for each part of anatomy that you're learning from. Also, they've got some really good diagrams which are really clear and easy to understand. With each section as well, they are like a mini quiz when they'll ask you between 3 to 5 questions, which I found really useful. As well with Teach Me Anatomy, and I think Teach Me Physiology also does this, they include bits about the medical relevance, which of course as a med student is necessary for you to know. With the information on Teach Me Anatomy and Teach Me Physiology, I would often make these into flashcards on Quizlet. You just don't learn from sitting there and reading something a million times. You need to make sure you're actively testing yourself and you're doing spatial repetition as well. Sticking with anatomy, the next resource is one that you do have to pay for, you do have to buy, but I still think it's really good, and that's the Grey's Anatomy flashcard. Yes, Grey's Anatomy is a real thing, and it's not just a TV show. So I've got mine here to show you. It's a big, hefty box. It's actually really heavy. As you can see, you've got all your, whoops. So you've got all your anatomy cards, and they are organised, not that you can see, but they're organised by colour code. And each colour is a different section. They've got really clear diagrams. There are numbers pointing to different parts of the picture, and at the back you've got the answer, and you've also got a medical relevance section. So this is about 40 quid I want to say for this set. I think they do update it every year. I got mine December 2020, and this is the 2020 version. And then I've also got access to an online version, so I can have it on my iPad and label it on my iPad. As well as drawings, the Grey's Anatomy cards, they've also got medical imaging, and again you label these, and then some of them, this one hasn't, also do have the clinical relevance at the back as well. Ideally you would learn surface anatomy as you go along and as you learn about the different sections, but with the Grey's Anatomy card they do have a whole section dedicated to just surface anatomy in the exact same format as the other sections. So things like Grey's Anatomy are really useful, and it really helps you to get a better understanding of what you learn about with anatomy, especially with the really pretty pictures. However, I don't really think this is always the best way to learn anatomy. Rather, I would recommend that you look at some sort of specimen, whether it's a pro section or you've got your own cadaver to dissect and you learn from that, or you look at pro section images. So the next resource I'd recommend is some sort of atlas. It can be whatever you choose, whatever your preference is, but some sort of atlas that shows you cadavers and shows you specimen that you can learn from and you can reference to. Because when it comes to your anatomy practical exam, your spotter exam, you're going to be identifying the component from a cadaver, and this is not going to be red and blue like it is in the Grey's Anatomy cards, but it's going to be brown, and they're all going to be the same colour. You can get things mixed up, so it's better that you get used to, you get familiar with looking at it on a real specimen just to appreciate it more as well. So at Nottingham we're provided with a subscription to one, and I think it's called Ackland's Atlas or Ackland's Anatomy. I'll leave the name here. My mind's gone blank right now because I've not used it in so long, but I recommend something like that. The majority of med schools do test their med students using some sort of multiple format questions, so you want to make sure that your revision is tailored to that way. So I recommend as much as you can doing practice questions. A really good resource for this is PassMed, and you get your first year subscription free. I recommend leaving this until like maybe later in the year. I'd say like December or November. If you get it in September, that's way too early and you aren't actually going to be using those questions yet, as there's a lot of difficult stuff that you've not yet come across, you're not yet covered, or you don't understand the format or the way you'll be tested. Just hang fire a little bit before you make a subscription. But a good thing about PassMed is that it's tailored towards university. You tell them where you go to, and the questions you're given are ones from your university. I found the questions on PassMed a lot harder than the things that we were actually asked when it came to our formatives and our summatives, but they were still really useful, and it was still good to have a resource like that to practice multiple format questions on. Another thing about PassMed is that it keeps track of your score, so it tells you the sort of questions that you're getting right and wrong, and then you can use that to guide your revision, so you're able to practice a specific subsection that you're struggling with in particular. Also, they give feedback with each question, tell you the context of the answer, and just some content to help you get to the correct answer. This resource is also useful for your clinical years, but it's still great to get started with it whilst you're in your pre-clinical years. It literally brings you all the medical resources that you need for your daily medical studies all in one app that's completely free, and you can download from the App Store or from the Google Play Store. When you download it and it asks you for a referral code, be sure to put my name, just Uwa Isibor, all one word. With the 360 Medics app, you're able to find precise drug information such as the drug dosage, and this is still useful in your preclinical years as you can learn about toxicity of the drug, the therapeutic window, stuff like that once you know the dosage. You're also able to access resources to support your studies and your learning, such as quizzes and flashcards. This is a feature on 360 Medics that I definitely making the most of, and that's the to-do list, which helps you to keep organised. And also 360 Medics has a drive where you're able to store your notes. This allows you literally to revise anywhere you are. So like I said, you can get this app for free from the App Store, and when you do download it, remember to use my code Uwa Isibor, just my name, all one word. The last two resources I've got for you are, first of all, Geeky Medics, which again is something that you probably use more in your clinical years, but it's still really useful in your preclinical years when you're learning about asthma and like questions you'd ask to diagnose it, or COPD or pneumonia, and also any clinical skills that you're learning and you're practicing for your OSCEs. They give you a breakdown of how to approach the different stations, so that's extremely useful. The final resource is Instant Anatomy, which pretty much summarises different subsections in anatomy. So for example, if you learn about the upper limb, you'll know about the nerves. It will tell you which muscle group is supplied by the median nerve, for example, instead of you having to learn the individual muscles and the individual nerve supplies, if that makes sense. It just creates the bigger pictures for you to see, and it makes anatomy learning seem a lot less daunting and a lot more feasible. So that's the end of the video, and those are the resources that I recommend for you to make the most of as a preclinical medical student. If you enjoyed this video, please don't forget to leave it a like and hit subscribe to join the gang. Also, don't forget to try out 360 Medics, the app that brings you all the medical resources you need into a single place. Thank you for watching. I'll see you in my next video. Bye guys.
Yeah, maybe I'm selfish. Ladies, and I can't. Maybe I'm selfish. I want you to myself, I can't help it. Yeah, no one, yeah, but me, yeah, baby. To my thick chicks down in Texas, all the way to New Orleans where the girls could catfish. And in LA, every chick's an